Mr. Chairman and colleagues. So my topic is conservative femoral revision with cementless short stem. For femoral revision surgery, we select implant usually in terms of classification of bone defect, like Pavlovsky. There is a trend right now, a long stem is used increasingly. So is that reasonable and necessary? This is my case, bilateral revision with long stem, but bilateral fracture. Also my case, you see the fracture happen to this side. That makes this surgery situation very, very challenging to manage. I found this fracture after surgery. So this brought me and patients to a very terrible situation. If PGI happened to this well-fixed stem, how do you remove, especially the distal part? I don't want to say long stem is not good, but it really works for femoral revision, but it also means more aggressive exposure and time-consuming, high fracture rate, and hard to remove, also more cost spent. For type 1 deficiency, I'm sure everybody agree with my point. The primary lens stem is enough. For type 2 defect, I use fully coated primary lens stem. For type 3A, you see this case, I use a little bit longer stem, just bypassed the defect, not engaged in the cortical bone. You know, according to the Pavlovsky principle, you have to engage in the cortical bone at least 4 centimeters. 4 years later, the bone remodeling very well around the stem. For type 3B, this is also infected with this very bad situation, bone deficiency. I did one-stage revision. 4 years follow-up, totally free of infection and bone remodeling very well. Type 4 deficiency. I use 90 centimeter length taper stem. You see slight subsidence over time, but stable without further progress, and ultimate side healed. The same situation. 3 months later, no pain, no subsidence. In this very complicated situation, long plate with multiple screws, I just put a shorter stem, which makes the surgery easier. In this situation, the cement full of, the canal. I just take out the cracked cement mantle, put an HA coating short stem. At 4 months follow-up, the patient is very happy with her new knee, new hip. The same situation, bilateral. I do stage bilateral revision with short stem. You see, this is a farmer. The government don't cover the cost, so she have to pay part by herself. So that is why she is very, very satisfied with this surgery. The pre-simple fixation for taper stem like this, which were very resistant to subsidence and torque. Taper short stem can be applied to revision cases with intact cortex of proximal femur if matching it. This is used in my revision practice. I look at literature. The taper short stem are most commonly used in Pavlovsky 1 and 2 defect. So the primary fully coated taper stem used in all my cases with type 1 and type 2. In some select type 3 and type 4 cases, I also use the short stem. I call it point contact secure fixation. The tapered HA coating stem could get more long-term stability because of fast and solid osseo integration. So in conclusion, this is less aggressive surgery with more host bone reserved and cost effectiveness. So both patients and surgeons must get benefit from this procedure. You know, the government, nowadays government and the insurance company also very happy with this kind of surgery. Thank you so much.
Thank you very much.